So we are here today for yet another press conference about the proactive steps that are being taken by the federal government, the state, and our city to ensure the safety of our residents. And I'm very proud today to be here as the mayor of New Haven, to underscore that New Haven is a place that welcomes collaboration with all of our different partners, and in particular collaboration with the greater region. It's at times like these that we need to work together. Just a few days ago, I stood with the governor at the CVS testing site on Sargent Drive, where thousands of residents around the state of Connecticut will be going to get rapid testing. Yesterday, I stood alongside community health partners to talk about standing up several testing sites in communities of color in New Haven where there are hot spots for COVID-19. And today I stand aside our federal partners, our state partners, our private partners to increase the availability of N95 masks to ensure the safety of our healthcare workers and first responders. It makes me very proud in particular that this site will not only be used for Connecticut first responders, but first responders all around the region. We have talked about from day one the fact that this region in Connecticut and the country are struggling with PPE. And so this site is a very proactive way to make sure that we're keeping our healthcare workers healthy and safe by cleaning PPE and returning them as quickly as possible to our partners. I do want to thank our federal leaders, Senator Blumenthal, Senator Murphy, and Congresswoman DeLauro, in particular for the work that they're doing on the stimulus packages to support so many people that are struggling in our community. And I want to thank Governor Lamont for your leadership in this time. This is a very difficult time for so many people, and us being very proactive and working together is a key to kicking this virus. I think that we've seen the reduction of the increase in cases over the last week or so, and that's an indication that the social distancing, that the proactive policies of the state and the city are working. So with that, I don't know who's next, but I will cede the mic.
Thank you, Mayor Elicker. And testing and masks, testing and masks, testing and masks. You want to get this state back to work, you want to do it safely, it's testing and masks. Yesterday, we spent a lot of time talking about how we're ramping up our testing in a dramatic way. Today, we're going to talk about how we get people the masks they need to stay safe. As the mayor said, first, hats off to our amazing congressional delegation. What they were able to do in terms of providing the funding that makes this possible at no charge to our hospitals, and more broadly, the next stimulus package that's coming out and voted on just yesterday at the U.S. Senate. And it's so much better for the work that Senators Blumenthal and Murphy put in place, because it provides not just more funding for the paycheck protection for our small businesses, but it also provides funding for our hospitals. It also provides funding for testing. It also provides funding for services like this. And a real thank you to our friends from Battelle. It was just a few weeks ago that we heard a little bit more about this amazing cleansing technology and what it could mean in terms of upping our capacity to clean the PPE, starting with the N95 masks. And through some mutual associates, we were able to reach out to Battelle at the very highest level and tell them why we thought Connecticut should be near the top of their list. And we just got the briefing. There are folks all over the country, all want this amazing technology. And I think Connecticut's the seventh location here in the state. They're going to be 60 over time. Seventh. They've already just practicing the testing now, and very soon we're going to be up to 5,000 masks per each of those quadrants. Probably do 2 a day. You could do the masks. That's tens of thousands of N95 masks. Making sure that our first responders are the first in line, making sure that they have the N95 masks that they need to stay safe. And this is a part of our strategy going forward, working collaboratively with Battelle and our other private sector partners, doing everything we can to stay ahead of this virus and get you back to work as soon as we possibly can. So Battelle, I cannot thank you more than enough for everything you're doing, getting this thing going. This will be operating 24 hours a day, just like Rosa DeLauro.
Thank you very, very much, Governor. It's an honor to be with you and with the mayor and with the Senators Blumenthal and Murphy and Battelle. Thank you. Jeff told us that the motto at Battelle was that it can be done, and you prove it. You're doing it every day. You're doing it at all these sites around the country, and making this service available to all of our hospitals, to our first responders, to EMTs, etc., so that we can have the masks that we need in order to keep people safe. The fact of the matter is, it is our first responders. It is the healthcare professionals. It is the doctors and nurses who are every day in intensive care units who are risking their lives in order to save other lives. And what Battelle is doing here today is saving lives. They'll talk to you about the process and how they do it with vaporized hydrogen peroxide and what they can do. It's based on their tradition and their history and their science and knowledge of these areas. And again, they're working with all of our hospitals in this state. I will be returning to Washington in a couple of hours so that we will vote on this interim supplemental package and provide the funding that's necessary for our small businesses as well as for our hospitals. And a piece of that money is for testing, with money going to the National Institutes of Health, for the Biomedical Advanced Research Development Agency to provide us with the opportunity to continue to do the testing that is necessary. If we can't test and if we can't have masks and the PPE, then we are not going to bring this pandemic under control. I am proud that this is a collaboration with the Department of Health and Human Services and the Federal Emergency Management Agency, HHS and FEMA. I have the opportunity to oversee the budgets of the Health and Human Services and of the Food and Drug Administration. We will continue to work. It's a public-private collaboration which can only work to save lives in our state. Thank you, Battelle, and thank all of you. God bless you. Stay safe.
I want to, first of all, thank the mayor. It's no accident that they've just opened 2 new testing sites here. His leadership, particularly for medically underserved communities, has been a great mark of his initial service as mayor for the city. Thank you, Mayor. Thank you to the governor. I don't know of any leader in the United States of America who has done more with more vision and more courage than our governor. So I think we can be enormously proud of Ned Lamont as our governor, and his leadership today is simply another step. Let's make no mistake. What we see here is our future. It is a stopgap because we need more masks. We need more of the N95 masks that are essential, absolutely essential to our frontline healthcare workers. We need to recognize and retain and reward them through a premium pay, which I am going to be pressing for in the Heroes Fund. But right now, immediately, they need and deserve the protection of adequate gear. And so this kind of cleaning, decontamination measure is an absolutely necessary stopgap until we manufacture what's really needed, using the Defense Production Act. The president has failed to do it. We're pressing him. We're going to pass legislation that forces him. The Defense Production Act is ultimately going to be the source of more protective equipment. Right now, decontaminating these masks is a way to keep our frontline workers safe so they can save lives and save us. Let me just say that what Battelle has done here is a great example of American ingenuity. This is American ingenuity and innovation at its best, a relatively simple scientific process that puts hydrogen peroxide to work and makes these filters reusable 20 times. So in effect, it gives us 20 times the use of every mask. That's a great step forward. But the decontamination is no substitute for manufacturing more of these masks. And finally, to the small businesses of Connecticut, there's a lifeline on the way. There's more money going to be available, hopefully by the end of this week. I've received hundreds of phone calls from small businesses that are hanging by a thread, and now there will be more money once the House of Representatives, hopefully within the next few days, passes this measure. It also has more money for testing, which is going to ultimately be the way we get out of this crisis, testing and contact tracing. So hopefully Rosa will be on her way, this measure will be passed, and we will prepare better. Lack of preparedness brought us to this point. Lack of preparedness is the reason that we are relying on these kinds of stopgap measures. And denying scientific fact, calling it a hoax, is part of that lack of preparedness. And that's why we are now playing catch up and playing for time in these kinds of stopgap measures until we can manufacture enough of the protective equipment to fully cover all of the healthcare workers. But we will get through it. We'll be stronger at the end of it. And thank you for the people of Connecticut for being resolute and resilient. Thank you.
Well, Governor, thank you very much for convening us here today. To the representatives of Battelle, thank you for making this commitment to Connecticut and to Connecticut first responders. This is extraordinary. 30 hospitals have already signed up to bring their N95 masks here. We know that there will be dozens more institutions and state departments who are going to be able to provide more public safety for their workforce because of this capacity. This is an example of the funding that Congress has approved through these emergency supplementals making a difference on the ground. This is a free service to hospitals and to healthcare providers. It's free because the federal government is providing a grant to make this facility happen. Governor Lamont is right. What matters now is that we keep people safe and that we test. You cannot be sure about opening up any part of our country unless you are doing enough testing to know that we have turned the corner on the virus. And in order to do more testing, we need more masks because we have to be able to be sure that we have enough protection to be able to have healthcare workers out on the front lines doing the testing while still having enough protection to man the inpatient wings. I spoke to a nurse yesterday who is dealing with the 10th day of a fever that won't abate because of her COVID diagnosis. She was a nursing home worker who in the early days of this crisis didn't have the protection that she needed, and she is now at home fighting for her life. We are playing catch up, but we are catching up, and that is what's important. We are being innovative. Federal partnerships with state governments, with private industry, to try to make sure that we have what we need to turn the corner. Let me thank the delegation, Rosa and Dick, for being such great partners. And then let me finally just thank Mayor Elicker. I think someone said before that he really has been a voice for the underserved communities to make sure that they get tests. But he's also been a spokesman for small businesses. And Dick and Rosa and I fought to make sure that this latest package of relief that the House will vote on this week, that the Senate voted on yesterday, assures that the Small Business Protection Program doesn't just help the big restaurant chains, that it gets money to the small mom and pop businesses here in New Haven. And so included in this new round of funding for small businesses is a set-aside account for small community banks so that that money can end up in the hands of those very small businesses that so far have unfortunately been told to wait in line for this program. And so I'm proud that as we are reauthorizing money for these programs that are working, like the PPP program, we're making adjustments to make sure that everybody and every business in our state and in this community of New Haven are helped. So again, to Battelle, to the governor, to the delegation, to the mayor, thank you for making this possible. This facility is going to make a big difference in our fight to turn the corner on COVID-19.
So I'm Jeff Rose with Battelle. So I think I understood the question is how many hospitals have signed up. There have been a little over 3 dozen thus far. There's more and more hospitals every day. We're working aggressively with the Hospital Association and emergency response agencies to get the word out about the service. So that increases each day, and today is day 1 here of operations at the New Haven facility. Yes, we're starting now, and hospitals are starting to ship their used N95 masks to us for decontamination. Yes.
And is this just for Connecticut?
It's regional, so we're having more and more of these units deployed across the country. So at this facility right now, they're primarily going to be Connecticut-based, but there are some others from Rhode Island, Massachusetts, New York, depending on what makes best sense for their specific needs. And as more and more of these units get deployed, that can always shift.
And how does the process work? What will be happening in here?
It's a vaporized hydrogen peroxide that the masks will be in. It's a couple of hours, about 2.5 hours within that solution, and then they're sort of degassed, and then they'll be able to, the whole process lasts about 5 or 6 hours.
How many can you do in this particular facility?
We can do tens of thousands each day. So, there's about 5,000 per unit, and so we have 4 units. So, depending on the volume that comes in, we feel like we can meet the needs here of the region.
In normal times, what would you be decontaminating? Obviously, other times we would not be decontaminating disposable things. So what would be your normal activity?
So Battelle is a science and technology and R&D organization. This isn't something that we had been doing previous to the COVID crisis. Quite frankly, we had done this research previously on behalf of the FDA after the SARS epidemic. They did a research to say what would ever happen if there was a national pandemic and there was a shortage of N95 masks, with some great foresight. So we actually did that research for them, published it in 2016. So when we saw the pandemic hit and the escalation in the needs and the shortages of getting the N95 masks to our first responders and our healthcare professionals, we had conversations with the FDA and said, we can take this research and we can scale it up into production level in short order to make sure that the safety and the health of our first responders and healthcare workers can be met with these N95 masks. So they can be decontaminated for up to 20 times. And really, as was referenced, this is really a buffer to try to help before we can get the supply chain up so they can have additional N95 masks made.
Regarding the executive mask order, can a business kick someone out for servicing someone who isn't wearing a mask? Because the order specifically says those with medical conditions are exempt from wearing masks. What if the business doesn't honor that? Should businesses go release some people go comply?
They asked Mayor Elicker that question the other day, and I thought he said it really well. Shame is the first form of enforcement we got. Each and every one of our businesses, they know what the rules are. We've made them very clear. If we get a complaint, we do send enforcement officers there. We urge them, we tell them strongly, these are the rules. People have to wear a mask in there unless they have a medical condition. We haven't had to go further than that because everybody's following the lead.